suddenly get all righteous is quite bizarre. And the funny thing for me, I mean, those of you who were aware of me during the referendum, you'll know that obviously I was being attacked and dragged through the media as a liar, etc., etc., etc. And that's quite amusing, because now the entire basis of the Labour general election campaign is, oh my God, the NHS will be gone in 5 years. And it'll be interesting to see what Jim Murphy and his team do up here, having told me for a year that I was lying. But no, there are people down there, but it's exactly the same as we had in the referendum. They don't get coverage, they don't get support. So what you can do on social media is find these things. When you come across it, retweet it, share it, put things in your Facebook. If you're finding things on TSA, get it up. You know, I mean, even TTIP, when I first started doing these meetings, I didn't mention TTIP. You've seen the one that went viral. I mean, I didn't talk about TTIP, free trade agreement. Who's going to want to hear about that? And then the very next meeting, someone's going, oh, we haven't mentioned TTIP. And now lots of people know about TTIP. But we're not meant to know. These things are meant to be secret. So the more we find them, share them with each other, and get them out in the open, the harder it is for them to actually do it. So, you know, we're lucky we now have at least one newspaper that talks about what we want, but we have to be the media. So whatever social media you're on, or whether it's just face-to-face media, talking to your friends, or, you know, writing to your children in England, or emailing people, is we need to share the knowledge with people, because knowledge is power. And the more people realize what is being done, not just to the NHS, but to the entire fabric of our society. You know, David Cameron said the three greatest things Britain did was the welfare state, the NHS, and weirdly he put the BBC as number 3. Number 3 was free education. That no matter where you came from, you could have whatever education you were capable of benefiting from. And they're getting rid of that. They're shredding the welfare state. Free education is long gone. Their kids pay £9,000 a year to go to university, and they are dismantling the NHS in front of us. So, you know, if we got independence, we weren't leaving the values of Britain. They're tearing them up. We actually want to hang on to it. So I think it's incumbent on all of us to not be shy about talking to our friends, whether it's friends in the real world or friends. All right.
Thank you.
You have to remember what you had on.
I come up with revenue, I thought, why am I doing such a lovely? And he started talking in the first couple of minutes, I thought, I know why I'm such a I thought it was really important what you were saying about all over everything we do in society. We have to think what is this going to impact on health. Because it's for me, particularly 3 or 4 days ago, there was the banner headline saying big survival in childhood cancer. Most children are surviving cancer, but I thought, well, every one of these is really we should be asking why every one of these happen. You know, why is Macmillan? I went to Macmillan conference and I said, you know, what are we doing about Trident? Nothing. What are we doing about nuclear issues? Nothing. Nothing. You know, it's more money for kind of treatment, but prevention is everything, because these, especially in children, the effects of the treatments are.
Well, I mean, the first report saying that, I mean, not specifically related to cancer, but related to everything, that we needed to actually be putting our money where our mouth is and preventing illness of every kind. I mean, that was written over 15 years ago, and we haven't done anything about it. So when we talk about health, people think about the NHS, which, as I've said before, is actually more of a national illness service than a national health service. Now, we do a bit of preventative, and we vaccinate people, and, you know, we give them advice, and we do something to prevent something worse. But the actual prevention, as I said, is right back at the beginning. And so if our children were getting a good start in life, if they were eating well, if we had much more active transport, and that's all across society, instead of getting off our sofas onto our, you know, car seats, and then sitting in a whole lot of smog, and then going into an office where we sit at a computer and we eat our sandwich while we work, you know, neither mentally nor physically have we done anything in that day that is actually good for us. And that's why I feel that health needs to not just be ghettoized in a wee chapter by itself, where people are only thinking of the NHS. It's public health. We've done some things that, cigarette ban has had a huge impact. Don't let anyone tell you that it hasn't. That the heart attack rate dropped, unbelievably over a year, and other respiratory illnesses. But we have problems of junk food. Rubbish food is cheaper than good food. If you are struggling and you can't pay your gas bill or your electricity bill, you can't cook good food. So you're going for dry, packety, hot noodly kind of things. And I know that from way back student days, or when I first bought my flat and the salary just didn't get to the end of the month. The cheapest thing was like pizza and half a tin of beans every day. Half a pizza, half a tin of beans. And that's what people can afford. And yet to buy fresh veg and make even a big pot of soup, the kind of thing our grandmothers made, is actually expensive. And unless we change those things and think about it in everything, in some of these big housing schemes that don't actually have a centre to them, is there anywhere that someone could walk and buy fresh food at a reasonable price? Or is everything's drifting out of town, to these supermarkets? And again, it's that business. We're losing small independent people. Big companies are getting a stranglehold. And as we saw in the last 2 weeks of the referendum, my God, we the four riders of the apocalypse. Oh, we're going to withdraw. And I thought, well, bugger all. We'll only eat meat once a week, but we'll eat good meat from the butcher. And that will be better for everyone. Sorry.
So, what I think is that I've got a lot of, I could go on and on and on. It's wonderful to hear. And also, the TTIP stuff is incredibly important. Because as I understand it, if the country decides, for instance, it doesn't want Monsanto putting GM crops in the country, or buying up all the seeds, what they're trying to do at the moment is patent every seed on the planet so that they own all the seeds, and that it makes it illegal for you to plant your own seeds on the next year. That if the government says, we're not letting you in here, they can then sue our country for profits they've not made because we won't let them come in. That's the legislation. It's so mind-boggling.
It's called investor-state dispute settlement, and it applies to any public health measure. So obviously we've already banned smoking in public places. If TTIP had been enacted, we would probably be sued for that. We're trying to bring in plain cigarette packaging so that young teenagers are not attracted by whatever trendy colour of packet or alcohol or these different things. And we know that Philip Morris, the big cigarette manufacturer, has sued Uruguay and is currently suing Australia for exactly that. And that they're not in the courts, they're in a special tribunal, which is only the judges on that are people who are on the business side. And that court is now planning to move from London to only be in Washington. And a state can't sue a company. So again, it's totally set up for them. Now, in TTIP, the investor-state dispute settlement, part of it has been suspended because people have been taking action. It's not just us. People in Germany, people across Europe have been out on the streets fighting TTIP. And whether all you're doing is clicking on one of these 38-degree petitions, or whether you're actually joining a group or getting out, we must make it clear we know what you're up to, and we're not going to let you do it. And what you need to do when you get home is you need to look up TISA, and you need to be adding that in, because actually there's a whole blooming list of these things.
And my question is, who pays who what there? I mean, how can they sue the country? Which country is going to pay them what?
Well, they sue the country that made that decision. And the problem for us, as a small independent country like Scotland, is if we, as I said, coalesce down to 50 or 100 enormous companies, they're already bigger than our government. They could buy and sell us. Well, eventually they'll be bigger than all governments, which means democracy goes out the window. Now, we're already there, because what you see is Westminster do what these companies want. But they would sue us. And the problem is even if they don't win, it would tie us up in these courts for years. It would cost us millions. And so what it does is it actually stops the government doing it. So it's not even that you reach the point of that. The threat of that means they go, we can't chance it. We'll not go for sugar limits or banning rubbish food in schools or plain cigarette packaging. And therefore we lose the ability not just to protect our NHS from privatisation, but to make decent public health decisions for ourselves. So that's what I mean, that we need to be alert and awake to, the curtain has been pulled back for us these last couple of years, but there's more people in Scotland know about TTIP than proportionally would know about it in England, because they haven't had this debate for 2 years. And therefore we need to make as much noise as we can and make it clear that they cannot go ahead with these things, because they are dangerous to our very democracy.
We've got 3 more questions, and then I'll maybe have a break, and then we can ask the other questions after the break. Okay? It's the lady.
We were talking TTIP terrifies me, I suppose, like everybody. But at the moment, we've still got free water, so we were talking about education, and we seem to focus on, processed foods, and everybody's kind of aware of the sugar impact. But one of the things that we don't seem to, I think we were talking about education. One of the good things would be to explain to people why it's better for you to give your kids water than fizzy drinks, and to explain that it's good for you, not just to say it's good for you, but to say actually your liver needs water. If it gets a wee bit of water, it will send it to your vital organs. If you don't give it any more water, it doesn't go to your skin or your nails and your hair. So people, if they knew, were more educated, and that's quite simple. So it's maybe things like that.
It's simple to say, but hard to get people to do. As a doctor who's been aware that smoking kills you for all of my 33 years, I will have women sitting in my clinic going, what have I done? How did I get breast cancer? And yet if you ask them, they smoke. So, we don't absolutely know what causes breast cancer. We know some little bits, but we don't have the equivalent of smoking and lung cancer or breast cancer. And yet everyone knows that. There's nobody alive who doesn't know that smoking contributes to lung cancer. And not just that. To strokes, to losing limbs, to emphysema, to COPD. I mean, stuff that very much contributes to you having this horrible, long deterioration in the later part of your life. And yet people still smoke. A lot of people are living such stressful lives now that they're only looking at the challenge in front of them. And we're seeing that with children. We all know, if we've had kids, the terrible twos. And we know that the whole terrible two malarkey is setting boundaries and, blah, blah, blah. And if you don't tackle it, you'll have a 4-year-old who's just running amok. And we've seen that more and more. Oh God, I was in this cafe and women couldn't control their children because if she's working and maybe doing 2 jobs, and maybe the husband's working as well to make ends meet, it's just, look, okay, just have it. Just have an iPad, have a tablet, have a can of Coke. And that's what we've got to, is that people are so much under stress that they're only actually trying to solve the immediate problem. Stop the kid wailing, put any kind of food on the table, keep the lights on, whatever. And therefore this luxury that many of us will have of thinking, right, what is the best way to go about it? How do I want to run my family? How do I want to balance family and work? How am I going to run my home? How am I going to influence my town? It's something that an awful lot of people in our society do not have the luxury of. And I feel that we need to actually use schools better. I mean, my son, like most people, will have done home economics for the first few years of secondary school. And what a load of rubbish did they cook. And my apologies if there's any home economics teachers here. No, but I mean, they made scones with no sugar at all. They made things with no salt at all. And therefore, for every one of those children, what they made tasted rubbish. So they thought homemade is awful. And they learned these fancy things like scones. You don't need to make scones. You should have been learning to make soup, to make bolognese, to make an omelette. And then in 6th year they offered survival cooking for students. That's what they should have been doing in first and second year. And that's where you bring in encouraging fitness, getting young teenagers to understand as they start to take more influence over what they eat and drink. You know, this is what will make you look better, make you be fitter, keep your weight balanced. And we don't. So there's an awful lot of things that we could do on a simple level, but they're not easy. Public health is not easy.
Hi, thanks very much. I absolutely agree with you. I'm a believer and worked in health and longer than I care to remember, longer than 70 years. And I absolutely agree that we have got a sickness service, really not health service, so completely in your camp with that, so thanks for that. I just wonder, I'm really interested in your comment about the Commonweal and how you're starting to get onto the agenda with health. I think that's terrific because I'm a great believer that economics and health just go hand in hand. So, because what we do need for people, and sort of on my soapbox now, is that you need to prove exactly what you're saying. So the Commonwealth staff thinking of doing some evidence around exactly what you're describing.
Yeah, I mean the Commonweal is enormous, and the project there. You know, if any of you heard Robin McAlpine during the referendum, you know the man is absolutely manic. And when I saw the plan of work that we are going to do, I was like, this is very Robin. Will we manage it? But we actually have a research group and a policy group where they are looking at evidence, they're looking at other countries and bringing things together. And when I was asked to go through the policy papers, I saw health, you know, number 13, that, and health in brackets. And I put to him the idea that actually health and wellness, so not just lack of illness, but actually quality of life should overarch every single thing. I mean, he was really taken by that. And I think that will happen with Commonweal. I've also written it to Nicola Sturgeon to try and get, you know, round that corner of not just seeing it as provision, but you were talking of, you know, treatment for when people are ill. The problem is you have a long period of time, a long lead-in, when you have to do both. You know, our NHS will cost more because we are able to treat more children with cancer. Inevitably, with dearer drugs, we're able to treat more women with breast cancer with dearer drugs. And the problem is you can't stop doing that while you make other people healthy. You actually have to find ways of changing the mindset, of bringing it into schooling, getting your local authority to think about how, you know, what are they going to do for traffic calming? How are they going to get cars out of the middle of your town? How do they get them away from the schools? You know, things like walking buses, you know, where you actually have guides who walk the kids to school. This kind of stuff. And those are the kind of things that, as a group like this, you could think, well, what is the biggest problem, or what are the biggest problems locally? And be there taking part in something with your badge on or your t-shirt on that people are seeing. Women for Independence are leading on that project, and we're leading on this project. And we have to actually do both together, and that's the challenge. Because you won't save any money in health for like 20, 30 years. But over time, people will be having a better quality of life, and we would get it. And there's no point in being independent if we aren't better.
And the last question for just now.
Yeah, sorry, I'm going right back to TTIP, and I meant to say this in the second half, but because it was right there, I have an invitation from our dear MP Anne Maguire to an information meeting on TTIP, because I once wrote her a letter about it. So I'm quite tempted to go, but I'm not really an expert. I know, you know, what most of us here know, and I'm going to read up on TISA. I was just wondering if anybody else had this invitation too and was going to go, and we could lend each other some moral support.
I'm a member of the Labour Party for almost 30, 40 years, and Anne Maguire and others still write to me asking me for money. And I think, what's going on in your back office if you don't know that I'm not a member anymore? And Anne Maguire gets lots of nasty, emails from me at times, so I'll go with you.
It'll be a closed meeting because we know that from the
Yes.
referendum.
Yeah.
Every single meeting that Labour ran was invited only. So you email in and say, I've heard there's a meeting, I would like a ticket. And they'll go, oh, yummy, yummy.
And I reply that
They won't even necessarily know that much. I mean, that's That's the problem. This is so secret, so many layers behind and above government, that there'll be lots of MPs, MSPs who did not know about TTIP and certainly don't know about TISA. So read up TISA and throw it into it and watch them squirm.
So do you know how people